And I want to use the example of a simulated bioterrorist attack that took place in 2001, June of 2001, just before the attacks of 9/11. A little bit of context. Over the 1990s, national security officials had become concerned that the Soviet Union had been stockpiling huge amounts of weaponized smallpox during the 1980s, and that with the decline of the Soviet Union, these stockpiles of weaponized smallpox had scattered possibly to rogue nations or terrorist groups, and that the US was woefully unprepared for the possibility of a smallpox attack. They began to wonder what would happen if the US was hit with such an attack. Since most of the US population did not have any immunity to smallpox, we had stopped compulsory vaccination in the 1960s. In 2001, a group of public health experts and national security officials collaborated to create a scenario-based exercise, a public health wargame called Dark Winter that simulated a bioterrorist attack on the US using the smallpox virus. The premise of the exercise was, if we can imaginatively enact this event, we can both learn about current gaps in response, and we can also convince public officials of the seriousness of this threat so we can get some resources devoted to it. The results of the simulation, it was a 3-day exercise held in Washington, D.C., the results were dire. The disease spread rapidly. It turned out that first responders were unwilling to help. There were not nearly enough doses of vaccine in stockpiles to immunize the public. There were not only massive numbers of casualties from the outbreak, but civil unrest and government breakdown ensued. The role player who was playing the president in the exercise, a former senator from Georgia, Sam Nunn, was especially struck by the problem of vulnerable first responders, public health workers, firemen, and so on, who, according to the scenario, would be unwilling to respond because they themselves lacked immunity to smallpox. He and others argued that the US should immediately establish a policy of what they called pre-event smallpox vaccination of first responders, that is, to immunize millions of public health and emergency workers in advance of any smallpox attack. The only problem with this program was that taking the vaccine itself entailed significant health risks. Smallpox vaccine is a weakened version of the smallpox virus, especially for those who are already immunocompromised. There were certain to be casualties from the government's vaccination program, whether or not an actual smallpox attack occurred. The committee that advises the Centers for Disease Control on vaccine policy, which operates according to a rationality of risk-based calculation, refused to make a recommendation on the proposed program on the grounds that they could not make a technical risk assessment, because while the risk of taking the vaccine was known, the risk of a smallpox attack was not known. There was no way to do a cost-benefit analysis. However, a year later, after the attacks of 9/11 and the anthrax letters that followed, and in the midst of the lead-up to the Iraq War, Vice President Cheney's office, charged with thinking about the threat of bioterrorism, was convinced that this threat was dire and insisted that the CDC approve the program. Meanwhile, large numbers of smallpox vaccine doses were added to the strategic national stockpile of medical countermeasures. You may know there are several huge warehouses around the country that maintain stockpiles of drugs and vaccines against a set of select pathogens. Now, this vaccination program turned out to be a fiasco. First responders were unwilling to volunteer for the program, and it was discontinued in 2003 after immunizing less than 3% of the envisioned 10 million vaccinees. One way to think about this is that there was an unresolvable tension between security authorities who were thinking in terms of preparedness and the health workers who could only be convinced through actuarial rationality, who did not see the benefits of taking the vaccine outweighing the risks. But it also points to a more general problem that preparedness efforts face. Since they must envision and plan for events that may or may not occur, it is typically hard for preparedness efforts to sustain attention and galvanize resources so long as the event does not happen. Consider the image of the strategic national stockpile, these warehouses full of drugs and countermeasures, now full of supplies of smallpox vaccine and Tamiflu that are expensive to maintain and may well never be used. Moreover, the credibility of these efforts is often undermined when it turns out that officials have been preparing for the wrong event. And we can talk about this more later, but there's a really interesting story from 2008 in which the World Health Organization responded intensively to swine flu based on their preparations for a different strain of flu and were widely criticized for having overreacted.